Welcome back. This is, this is Dr. Cynthia Correa Cedeno. Welcome back to Balance Steps. I'm Dr. Cynthia Correa Cedeno. I'm one of your co-hosts, and I am located in Orlando, Florida. I am the founder of Orange Sky Podiatry. I also have my co-host here, Dr. Sondra Mottar, and she is out in Tempe, Arizona, direct care podiatry. No, wait, direct Arizona. Wait, I messed that up. What's the name of the company?
Podiatry, Arizona.
Is it Good Luck Podiatry, Arizona?
Yeah, Direct Podiatry, Arizona.
Direct Podiatry, Arizona. I am sorry. I've only been with her for a while and I still forgot. But you know what? Good Luck Podiatry might be a really good business name. Good Luck Podiatry, Arizona. That's a good one. So we're back today. This is season 2, episode 2. Whee! And the name of our title, which is L is the title of today's episode is Direct Care Isn't a Business Model, it's a boundary. Yeah. And for you that don't know direct care, you're like, what? Those are the physicians that decided to work more one-on-one with their patients. And the only way that they could really do that is by uncoupling themselves from conscious uncoupling from health insurance plans in order to really give our full attention to you, the patient.
Yeah. You know, a lot of times when you're practicing inside of the insurance model as a doctor, it's focused on output, so very high volume and just kind of maximizing revenue. And that revenue honestly doesn't even go to the doctor, it goes to the shareholders and the CEOs of these insurance companies. So, because reimbursements are so low, what the doctors get paid for each patient by, insert name of any insurance company here or majority of them, especially when you're in private practice, you really have to increase the amount of patients that you see daily, hourly.
Yes.
And,
Yes.
we're human at the end of the day. We're not machines. So there's only so much you can increase until you can't increase anymore. And patient care, even with the most well-meaning, most intentional, kindest, most sensitive doctors, will go by the wayside because you're just having to increase the amount of people that you see in a day. I know that especially when
it's less efficient. There's just less efficient because you could probably see those 30-40 people a day and make it efficient, but because they scale so fast, everything went to the wayside. They just sacrificed everybody else, aka also the patients, and they didn't make it efficient. Like I would see people and I didn't even have their medical history, their medication, and now I have to go back and do all of that.
Exactly.
So it's like we added more and more people, but we didn't put the systems in place to make it efficient.
Yeah. And honestly, I don't think there's any way it really can be, because I know what like a lot of practices do. They will double, triple book patients so that they can squeeze in as many as they can. So like, let's say your doctor tells you have an appointment at 9:30. You're not the only one there at 9:30. There's maybe 2 or 3 other people they told your appointment is at 9:30. So if there's any hiccup like in the system with maybe someone came in with a bigger concern than what the doctor was, thinking about, maybe someone came in late for whatever reason, that throws off the schedule for the rest of the day, and it's a huge
Completely.
So that's why a lot of times, unfortunately, when you go to the doctor, yeah, they told you to be there at 9:30 or your appointment's at 9:30, you're maybe not getting seen until 10:30, 11 o'clock,
If that. Yeah.
11:30 sometimes,
Yeah.
and
Yeah.
it's very frustrating. It's extremely
It's built on a house of cards. Like there was just no stability there. It doesn't. With direct care, I mean, this protects me and it protects the patient there's better boundaries in place. People still get, I mean, they still get surprised when I'm the one that's greeting them at the door. I'm the one that walks them back into the room, and they're like, "Who else?" I was like, "I got to see CLE people." I was like, "No, that's like noise. That's not efficient." To go through all of that because they're doing that to comply with their health insurance plan, which is smart for that business because that's what they need. But that's not in my business. My business is you. I'm in the business of human medicine.
Yeah. High touch, high focus. I think one of the things that I like still love about direct care is that you really get the chance to get to learn people, know them on a first name basis. You can put face to names when you're seeing like 30 to 50 people a day. Um, is very difficult, if not impossible, to do that. Like, and even if they have multiple times that they come back to you for the same issue, a lot of times you're not going to remember them, because you're so inundated every day by everyone that you're seeing. But in a direct care practice, the amount of people that you see is a lot smaller. It's one on one. So I can take my time with people. I can get to know people. And then, too, especially if people are having like anxiety about a procedure,
Mhm.
I can reassure them like, hey, it's just you and me here. I don't have to, get out of this room to go to another exam room to take care of somebody else to come to you. So if you need more time, I can give you more time.
Yeah,
I have no
yeah, that reassures them.
yeah,
And this model, I mean, it supports long term sustainability. Um, and it's not, and I understand that that's not for, not every patient want this, not every doctor wants this, but it is an option out there. I really do see it as we all need each other. There are some people that need it that way. There are some people that don't need it that way. And I just didn't work out in that model. There was less boundaries. I mean, I never knew what was going to be on my schedule. It never mattered. I had no control over it. And I mean, that was extremely frustrating. I had no control at all. I just did. And you say yes, yes, yes to everything, but you say no, no, no to you. I kept saying no to myself.
exactly.
I wouldn't even go to the bathroom. I, I couldn't even go to the bathroom. I couldn't eat, didn't drink any water. Everything that I was telling my patients to do, I wouldn't do.
Yeah, which isn't good because I think when the healer isn't well, it's like there's no way we can pass along health and healing to our patients when we ourselves are not well. When we are, stressed out or going through a lot of different things, when our health is in disarray because we're constantly self abandoning to serve this bigger system, then how do we expect our patients to get better? I don't think it can exist, honestly.
I mean, yeah, I mean that's how we see it, but it is existing in its own way. Um, how much that's helping, I really don't know how to quantify that. I'm not a statistician or anything like that. I just know that with this system, I have boundaries as the physician. I have more autonomy as a physician. Um, it's my life, my life in this world. I didn't feel like I was the main character. I wasn't even a side character,
Yeah, just a cog
which
in the
is yeah, just another cog, and
it's not a
that
good
was painful. No, that not a good place. Not a good place. I mean, is this, people are like, who's going to pay for this or whatever? I mean, people are paying for Gucci bags. I mean, people are paying for those cyber trucks. Like, I mean, people are paying to compete in like
you know
all these like competitions and stuff. It's like if the value is there, the money will follow.
if there's
Um,
value, they'll pay for it. I am kind of chronically online. Unfortunately, I'm trying to get better about that. And I was on Instagram a couple days ago and I saw a hairstylist. I think he's in Atlanta that charges. Have you heard of K-tips before? It's like a type of extension where they take like a bond and like bond it to like your actual hair. And
lived through extensions vicariously through my friends.
okay,
I have never had extensions. It was one time in sixth grade. I had a really bad experience with this hairstylist. I didn't know what the hell to do with my hair. If anybody's seen me, I'm Puerto Rican, so I have like, it's not kinky, it's curly. But she didn't know what to do. And she put so much grease in my hair, and I look like a whole different person, and that traumatized me.
Yeah.
Oh my God. So I have never laid an extension on me.
Okay,
Uh,
that's fair. So this hairstylist, she
so I was
does
like, that's why I asked my friends. So all my friends out there, if you're listening, I'm just living vicariously through you. I was like,
exactly like
because I'm not going to put it in my hair. I'm too scared.
like probably what 10 years myself, but yeah. Oh yeah, my bad. So yeah, so I probably haven't done extensions myself probably like in 10 years. But anyway, so there's this hairstylist in Atlanta that does like K tips where she takes like the extension and there's like a little plastic piece at the end and she like bonds the plastic piece to like your natural hair so that it's like flowing and all that type of stuff.
Mm-hmm.
So for your whole head, she charges $2,000. Now,
Mm-hmm.
for some people that would be worth it if you're really into extensions, you want the look of K-tips, you
Mm-hmm.
don't want the look of wigs and tracks and getting the braids down, all that type of stuff. Then yeah, 2000, you got the money to spend, you're going to spend it. And K-tips, I guess they do last a long time too, but for some people it's not for them. So I say all that to say, like, it goes to show that people will spend money on what they choose to spend money on. If it's something of value to them, it doesn't have to make sense to the next person, but as long as it makes sense to them. And I think also to the person that it has that service, as long as they can market it well, then people will
Yes.
pay. And this woman is
Yeah.
making, and she does beautiful work. Like, I looked at her before and after again just because I'm curious, and I'm like, oh my god, that's beautiful. So
Yeah.
people are paying her happily $2,000, every like 20 weeks or however long they last, to do that. And she teaches courses now. She does everything, and people complain in the comments like, oh, it's too much. It's like, okay, well, maybe that's not for you, but for a collective of women,
It
2,000,
is.
what they're
Yeah.
doing.
It's just a niche of those people out there who are looking for physicians like us, and they are willing to pay because they want to be guided by a medical professional, an expert, someone who's board certified, someone who's using their medical degree, their surgical knowledge, and all of the years. I mean, I've been working now since residency, almost 7 years now. And you too, Link Sondama, or is it 5 years? I think I was a year ahead of you.
Yeah, you're a year ahead of me. So I
Yeah.
graduated
So it's
2017.
like, yeah, so it's like 5 years. And that's not counting the 3 years of residency, which still counts. No, it still counts. And we're still doing like medical educational program. Again, we're out there. We're here to help. We're, anti all of this. We're pro boundaries. We're pro human medicine. And that's what we wanted to do in our business and with our profession. Because if not, I'll be in Puerto Rico, selling the pina coladas by the beach, being sticky.
Somewhere in Africa, maybe Kenya.
Yeah, she'll
Just
she'll probably be on
also
on a safari.
exactly, probably just
Yeah,
vibing, eating my sugar
yeah.
cane, living my best
But
life.
this is what we want to do with our limited time. We're choosing to go against the grain. We're choosing to be part of that 10% of physicians who are still independently owned, that are still wanting to give that excellent care, to be pro human medicine, and still have our own boundaries.
Yeah.
Yeah. So keep listening to us. Subscribe, save us. Tell your auntie about us. We're here. And yeah, so I'm Dr. Cynthia Correa with Balanced Steps, and this is my wonderful co-host.
Sondra Mottar.
All
And
right,
until next time, take care.
see you next time. Bye.